Hi everyone, a little bit more on when your patient may need a second opinion for bunions, also known as hallux valgus or hallux abductor valgus. Particularly if the patient's treatment to date has failed and they're still finding pain, then that's where we may be looking at a second opinion for surgery or for some advanced care. And for all of these, it doesn't necessarily mean that someone like myself is going to go ahead with surgery. It's just giving that patient the understanding and opinion of what we might be looking at there. If there is no response after several visits and the patient's getting frustrated, or you're getting frustrated and not being able to help, or you're wanting some further advice in how to help, that's where a second opinion comes in as well. If the patient is in quite high levels of pain on that first consultation though, definitely consider whether they may be appropriate for a more specialist opinion, a surgical opinion with regards to that, so that we can put them on the right track to a pain-free activity as soon as possible. Now, if they have deformity that's impacting their activities of daily living, so their normal walking, cleaning, their ability to get out of bed, then that's definitely a reason to have that sooner second opinion so that we can get our patients active and participate in all of their activities that they can undertake there. Really, if they're finding that their deformity is quite large on x-rays, that hallux valgus is quite large with regards to the hallux valgus angle or the intermetatarsal angle, or there's degeneration of the first metatarsophalangeal joint that looks potentially progressive, then that's where we need to have a little bit of a further look at whether there may be a second opinion required. And of course, most of the time our patients are going to be coming to us as professionals for advice, and some of the time they're going to be saying, what about surgery? Now, of course, not everyone's going to know about all the ins and outs of surgery, and for those instances, it can be really effective to jump through, give them that potential second opinion there so they can learn everything that they need to know and go from there. Of course, here's a few videos on that as well that you're more than welcome to share with our patients. If you're liking them, hit the subscribe button, have a look at some of our others, and we'll go from there. See you on the next session. Cheers.